In this video, we will talk about the Ehlers-Danlos syndrome hypermobile type. This video is aimed at patients, associations, and healthcare professionals that want to know the basics of this EDS subtype. Ehlers-Danlos syndrome hypermobile type is the most common of the 13 different types. It affects approximately 1 in 5,000 people worldwide, thus qualifying as a rare disease. The inheritance pattern is autosomal dominant. Each person receives half of their genetic material from the mother and the other half from the father, here represented with the pink and blue chromosomes. If one of the two transmits the genetic mutation responsible for the disease to the child, they will be affected as well. A person with this condition has a 50% chance of transmitting it to the offspring in each pregnancy. However, it can also be caused by a spontaneous mutation, which has not been inherited from either of the parents. The genetic mutation for hypermobile Ehlers-Danlos syndrome has not yet been identified as of 2019. As a result, the diagnosis is entirely clinical, following the criteria published in 2017. Nonetheless, the HEAD study, sponsored by the Ehlers-Danlos Society, aims to find the gene associated with this type of EDS. Some of the signs and symptoms of hypermobile EDS are joint hypermobility, which is usually generalized and affects multiple joints. Recurrent dislocations and subluxations of several joints. Soft and hyperelastic skin that stretches more than normal and is velvety to the touch. Pain, which is often chronic and widespread. Mitral valve prolapse and mild aortic dilatation, which are diagnosed by ultrasound or other imaging tests. Presence of atrophic scars and stretch marks in areas such as the lower back, thighs, stomach, and chest. Multiple and recurrent hernias and organ prolapses, such as rectum, uterus, or bladder. Arachnodactyly, which refers to very long, thin fingers and an increase in arm span to height ratio, called Marfanoid habitus. Not all patients have the same symptoms, and these vary in intensity depending on the person. In addition, the syndrome may be accompanied by other comorbid disorders, such as gastroparesis and gastroesophageal reflux disease, dysautonomia, mast cell disorders, anxiety and depression, and many more. EDS can cause a wide range of disorders that affect the normal functioning of the digestive tract. An example of this is gastroesophageal reflux disease. Under normal conditions, the lower esophageal sphincter remains closed and prevents food and stomach acid from moving back up into the esophagus. If this sphincter is incompetent and does not close properly, the acidic gastric content may rise up the esophagus, causing various symptoms including heartburn, chest pain, and even difficulty swallowing. Another gastrointestinal condition is gastroparesis, which is the slowing down or the absence of the stomach's normal forward propelling movements. Under normal conditions, the stomach contracts to propel its contents to the duodenum. In gastroparesis, the normal peristaltic movements are diminished or totally absent, and the food bolus remains too long in the stomach, causing a variety of symptoms such as nausea and vomiting shortly after eating, early satiety and abdominal bloating, and recurrent abdominal pain. There are also other conditions that accompany the disease, such as dysautonomia. Autonomic dysfunction is an alteration of the autonomic nervous system, which is responsible for regulating the involuntary functions of the body, such as heart rate, blood pressure, respiration, digestion, etc. The most common type of dysautonomia in EDS is postural orthostatic tachycardia syndrome, also known as POTS. POTS is characterized by an exaggerated increase in heart rate at the time the person stands up from a lying position. Symptoms include dizziness, fainting, heart palpitations, sweating, weakness, and a lot more. Another comorbid condition is mast cell activation syndrome. The body has specific allergy cells called mast cells. In MCAS, there is a normal number of mast cells, but these are dysregulated and hyperreactive, meaning they are triggered and activated by typically harmless substances in the environment. As a consequence, the mast cells undergo degranulation and release substances called mediators, which are responsible for the myriad of anaphylaxis-like symptoms, including hives, inflammation, low blood pressure, difficulty breathing, and severe diarrhea. In addition, there are also patients that experience chronic or recurrent fatigue, as well as anxiety and depression, usually aggravated by the frustration and chronic pain secondary to the hypermobile EDS. The diagnosis is usually difficult since the symptoms can be attributed to other diseases, and there is also a great disregard of the syndrome in the medical community since it is a low prevalence disease. Often the patient visits multiple doctors and undergoes many tests, some of them very invasive. Finally, after many years, in most cases, the patient gets a diagnosis. And now what? Currently, there is no cure. Only palliative measures can be applied to alleviate the symptoms. One of the most important factors is the regular practice of exercise and physiotherapy. Low-impact exercises on the joints are recommended, which makes water an ideal medium for workouts. In some cases, it is necessary to use drugs and orthoses. Some accompanying symptoms of EDS may require the use of medications such as painkillers, and some unstable joints may be temporarily protected with splints. It is also very important to have the support of family and friends, and actively participate in leisure activities and dedicate time to the things one likes most. Finally, ask for help if you need it. Follow your doctor's recommendations and seek psychological help if you need it. With all this advice and a positive attitude, the condition can be a little more manageable. Thank you very much for watching this video.